Now we're going to see the screen test for diabetes mellitus during pregnancy. So we start at 24 to 28 week gestation to evaluate for diabetes mellitus as a general rule. But in the next video we're going to see some cases in which the universal test is done during the first trimester, besides doing it on the third trimester. So, but besides that, the universal diabetes mellitus screen test for pregnancy is during the third trimester, between 24 to 28 weeks gestation. We start with an oral glucose load of 50 grams, and the patient does not need to have fasting. So oral glucose load of 50 grams. Then we wait for an hour. An hour later, we measure the glucose, and then we ask if the glucose is greater than 140 milligrams per deciliter. So if the blood glucose is less than 140 after 1 hour, so the patient does not have diabetes mellitus and no further testing are needed. No further testing are needed. If the blood glucose 1 hour after the oral glucose load of 50 grams is greater than 140, then if yes, then we go to the 3 hours oral glucose load test. So first the patient is going to have an overnight fasting, overnight fasting. Then we will measure glucose. If the fasting blood glucose is greater than 126, if it's greater than 126, then this is diagnosis for diabetes mellitus. But if fasting blood glucose is less than 126, then we go to 100 grams oral glucose load after being fasting for 1 night. Then we are going to draw blood glucose, or draw blood for measure glucose 1 hour, 2 hours, and 3 hours after the load of 100 grams. So measure blood glucose after 1 hour, 2 hours, and 3 hours. And if the the blood glucose is more than 180 after 1 hour, this is abnormal. More than 155 after 2 hours is abnormal, and more than 140 is abnormal. So I will call this positive, positive, positive. Then if we have more than two abnormal values, if more than two abnormal values, this is diagnosis for diabetes mellitus. So yes. Yes, this is diagnosis of diabetes mellitus. If no, if we had none of these abnormal, then no further testing is needed. If we have one of these abnormal, so if only one is abnormal, then the patient has does not have diabetes mellitus, but she has high blood glucose. So we are going to treat that. We are going to see that in the next video. But 2 or more abnormal tests is what is diagnosis for gestational diabetes. 2 or more is diagnosis for gestational diabetes. In the case that the patient has had an overnight fasting glucose greater than 200 plus fasting blood glucose greater than 95, then this is diagnosis of diabetes mellitus, and then no further testing for the 3 hours screening after 100 grams oral glucose load is needed.